Okay, so this is TAR J. So this is a quote that I found on the internet. I'm not sure who actually said it. If life's too short to make up with regrets, so love the people who treat you right, forgive the ones who don't, and believe everything happens for a reason. If you get the chance, take it. If it changes your life, let it. Nobody said it would be easy. They just promised it would be worth it. I really like the last part of this where it says, if you get the chance, take it. If it changes your life, let it. Too many times we get set in our ways and we decide that we don't want change, we don't like change. But in the healthcare field, we have to embrace change because change can be a good thing. Even just in our everyday life, change can be a really good thing. Now, yes, there are always downsides to anything when you go to change it, but progress cannot be made without change. Okay, so purpose, objectives, and requirements. This is going to be from pages 9 through 12 of your textbook. You're going to perform your tasks such as vital signs and provide assistance with routine personal care. You need at least 75 hours of training, and in many states, training might exceed over 100 hours. Observing and reporting is a very important role of the NA or nurse assistant. Educational requirements for certification. This is from pages 416 to 417 of your textbook. You need at least 75 hours of training, 12 hours minimum annual continuing education, and a certification exam. The state registry is often maintained by the Department of Health for that state, and employers are able to access this list by contacting the department who oversees this registry. You can find out about the reciprocity, which is moving the certificate from one state to another. Requirements that vary by state is going to be how quickly after completing a training program that you need to take and pass that certificate exam, and how many days a year you must work in long-term care to maintain certification. How many hours of continuing education you must take each year is also going to vary by the state that you work in. Qualities of a nurse assistant. This is from pages 12 through 14 and 20 through 21. You should be professional, compassionate, have empathy and sympathy, be tactful, conscientious, and keep information confidential. That's very important. Dependable, respectful, unprejudiced, tolerant, honest, follow the rules, and do not perform outside of your scope. On this last one there, I want you to really be cautious about not performing outside of your scope. Scope of practice of a nurse assistant. This is from pages 14 through 16. You do not administer medication. You refusing to do something outside of your scope is your right. Do not perform sterile techniques. Do not diagnose or prescribe treatments. Do not tell the resident the diagnosis or the treatment plan. Someone else is supposed to do that. An employer may provide an additional list of tasks that they do not want you to do. Important of accurate documentation is from pages 40 through 46. The right information must be collected before documenting it. Facts are most useful. Using the census helps to make a more complete report. Information should only be shared with the care team. I want to caution you about that one as well, because if you have a different team than your coworker, but you guys both work in the same hospital on the same floor, legally, if you talk to your coworker on lunch about your patient and your coworker has nothing to do with that patient at all on the care team, that is a different team. So that's not on the right patient's team. So that's considered a HIPAA violation. You have to make sure that you're only sharing it with the people that are responsible for caring for that patient. Use military time, black ink, and legible print. Single line correction. This is so that we can still see what was originally written. Documentation is a legal document, and it's covered in more detail in TAR D. Your references for this TAR was your textbook.